Okay, good afternoon, everyone. Thanks for joining us today. My name is Michael Morgenstern. I'm the head of marketing at the Expert Institute. Today's webinar will focus on plastic surgery, chemical and electrical burns. Our presenter today is Dr. Thomas Zaidan, an experienced, expert, and board-certified plastic surgeon. Dr. Zaidan has over 20 years of experience. He performs a wide range of reconstructive plastic surgical procedures, including treatment of burns, facial, nasal fractures, and treatment of scars. Dr. Zaidan has experience with both the defense and plaintiff firms. After the presentation, we'll set aside some time for Q&A. You can type your questions into the question box on your control panel, and Dr. Zaidan will answer you verbally. Please save your questions for the end of the presentation. And thanks again. Please welcome Dr. Zaidan.
Good to speak to everybody again. I spoke on scars about 3 or 4 months ago, and it was very helpful, and I hope this will be helpful to you. We certainly remember that victims of electrical burns and chemical burns can fall into the realm of both plaintiff and defense. These are equal opportunity injuries. Mike, can we go to the next slide, please? They are very common, but they cross all walks of life. I see these injuries in wealthy people in great neighborhoods, and I see these injuries in impoverished folks. Trauma is the equal opportunity stimulus. Now, electrical burns and chemical burns are usually survivable. You're going to hear about some horrific things, but they're usually survivable. So they end up in the courtroom because there is significant permanent disability after either burn. So almost always there's a living person that is in the courtroom. Today I'm going to chat with my colleagues in law about the diagnosis of electrical and chemical burns, prognosis, what to expect, and give you a brief overview of the medical management. I know that I'm not speaking to doctors, and I'll keep the medical stuff to a minimum, but I think by the attorney understanding some of this nomenclature, it'll help you evaluate the extent of these injuries. But before I get started, if you hear electrical or chemical burn, you're almost always dealing with a significant permanent disability. There's very few trivial chemical or electrical burns. Next slide, please. We're going to talk briefly about the depth. This will be at the end of the presentation. I'm going to go over some of our basic nomenclature about what burns are first, second, third degree, explain to you about the body surface area. And I will share with you, if you go to the internet and you read under jury verdicts, there is actually a very good science with jury verdicts in the percentage of body burnt, because juries understand that electrical and chemical burns not only are painful, but they are disabling. So if you're in mediation and trying to get a sense of where the jury may come back, it is widely available, the percentage of the body burned with the verdict from the jury. Keep in mind that both electrical and chemical burns have problems that are outside of the burned area. Very often you'll see a small burn on the skin, whether it be chemical or electrical, and adjacent to the skin is a problem with the muscle, a problem with the nerve, a problem with the heart. And it must be kept in mind that problems outside the zone of injury are very common with electrical and chemical burns. That being said, that's our agenda. I hope it's helpful. If we can go on, Michael. Typically, electrical and chemical burns are seen in the workplace, although they are seen by innocent bystanders outside of the workplace. They're the fourth leading cause of traumatic fatalities. The majority are survivable, as I mentioned, but about 500 people a year are killed during the course of their employment. Next. So what happens when the body gets burned? And this is helpful for you to understand, because there's a lot that goes on when there is a chemical or a electrical insult to our body. It's a very delicate organism, and it's not used to having this kind of insult. Obviously, the first thing is pain. That universally, there is going to be a pain response. If you remember from your basic science, it's called a fight or flight response. So as soon as there is a chemical or an electrical burn, your body releases all of these chemicals called catecholamines. Your heart will race, you'll breathe fast, your blood pressure will go up, and you'll have mild or moderate anxiety, as you can imagine. It's called the emergent phase. So obviously your body knows something bad has happened. These people are almost always transferred emergently to appropriate medical care. And after the end of the day, 18 to 24 hours later, the body begins to shift. All the fluid, all the plasma, all the blood goes from one area of the body to the other. And the reason the body does this is the body's response to injury. And the body blows up. You'll see what they call massive edema. That means massive swelling. The reason there's this massive swelling after this chemical or electrical burn has to do with fluid shifts. This is the organism that God created trying to save itself. Next. We can advance the slide. So after a day or so, the body will start to shiver and go into a hyper-metabolic phase. It'll really go into fast speed, super fast. And of course, it's very important that the body is hydrated, that the body is nourished. And I wanted to share with you that this science from burns has helped us in all types of patients that have both elective and emergency surgery. It is important that nutrition not be ignored in a patient with trauma. Clearly, whether it be elective surgery, if you're going to go have your hernia fixed or have a mole removed, the body that is well nutrited, which is healing, which is in a positive nitrogen balance, will repair itself better. And then, of course, phase 4, this is we as attorneys, you as attorneys, see the plaintiff and the defendant. Almost always there is scar formation. Scar formation is the body's response to an injury. The body heals with the scar. So 100% of the time, there is a scar after a chemical or electrical burn. And in some states, you need to have a permanent injury in order to have a course of action. And I can say with absolute certainty that whenever a scar forms, there's going to be some permanent disability. And it's up to the doctors and the lawyers to explain to the jury the extent of the scarring. Very important with all types of burns, rehabilitation and progression is very important. You want to put, once they're healed, you want them moving, you want them in the gym, you want them in PT, you want them in OT, occupational therapy, physical therapy, you want proper compressive garments, you want the patients to progress to normal function as soon as you can. By doing so, you prevent complications of chemical and electrical burns. Okay, next. So real quickly, obviously electrical burns typically are due to the fact that the person has come across something unexpected. Almost always electrical burns are of the high voltage type. I see almost no low voltage electrical burns. Fortunately, they're not common, but unfortunately, when they occur, it's a major endeavor to take care of these patients. And going back to basic high school physics, in order to have burn, you have to have resistance. So you have I'm not going to get into the science. You have to usually, if not always, an electrical burn have an entrance wound and an exit wound. Almost always, if in the absence of an entrance wound and an exit wound, you don't have a burn. It is possible, if you're properly grounded, not to have an exit wound, have a major entrance wound, and believe it or not, have virtually no damages. So we always, always, always look for entrance and exit electrical burns. Next. And if your skin is dry, you have greater resistance. So if your skin is wet, like if your foot's in some water, you have less resistance. And sadly, the less resistance, the longer the contact, the worse the injury. Very often, a small point of contact, this is very important, a very small point of contact causes more concentrated injury. So you may have a very teeny little pencil point of electrical energy, but it's going to travel through the body with tremendous force. Next. As the electricity travels through the body, it's going to injure blood vessels, sadly. It's going to injure nerves, sadly, and it's going to wreak havoc. So we're not only seeing skin issues, we're seeing issues with the muscle falling apart because of the electricity. We're seeing the bone being calcified because of electricity. We're seeing heart attacks. We're seeing nerve damage. These are sadly major claims in the legal arena. They lead to serious vascular and nervous injury, and it's not good. Next. And you can, again, they're very serious. This worker, this is a fellow that I saw, he forgot to turn off the electricity. He went to work, and by forgetting to turn off electricity, he ended up losing a finger. So even though this was a low voltage injury, he had damage to the nerve, the muscle, the bone, and he ended up losing a finger. The severity of the injury is determined not only by the amount of force, if the resistance, the finger happened to be wet, and the duration. What happens is people, when they get electrocuted, their muscles go into a shaking modality that we call tetany, and it's very hard to let go. I hope you never need this advice, but if you come across someone who can't let go, do not force them off the electricity. You'll become part of the problem. You need to turn the electricity off first before you're a good Samaritan. And when I get to chemical, I'll give you some safety rules as well. But God forbid that you come across a injured human being who can't let go. Do not help that person. Turn off the electricity. If you attempt to help that person, you will become electrified also. Electricity is very, very, very powerful. Next. Again, an entrance and an exit wound, and this will want to demonstrate that unlike a gunshot where there's a projectile of electricity, goes through the whole darn body. It goes in one foot and out the other, but on its way it causes havoc to the heart, and it causes havoc to the nerves, and causes havoc to all the body structures. I don't think one body structure is spared. In some ways, electrical burns are more ominous than gunshot wounds. Next. This is a person who was working underneath a electrified, I think it was a stove, and sadly forgot to turn off the electricity, went to work, and they have an entrance and an exit wound. Electrical burns have a lot in common with all kinds of burns. Chemical burns, electrical, water burns from Wendy's, from Chili's. I mean, burns have a lot in common, but the main message I want to leave my colleagues in law is electrical burns wreak havoc to the whole body, not just the skin and the adjacent structures, the whole body. Next, their major claims. And again, this shows early on that you get what they call a vesicle, the surrounding erythema. Basically, there's a pattern. What you see is the pattern of electricity. This pattern that you see next on the right side of that of the patient's bed, this shows the pattern of the grid. Okay, next. And it's important to understand that the blood, not the blood, the skin becomes homogenized, much like milk becomes homogenized. And this is a microscopic slide of skin that has been homogenized by electricity. The cells are no longer living. They are just, they're basically petrified. I think that's another thing I could use. The lines of demarcation have been obliterated. There's no more energy produced by the mitochondria. There's no talking from one cell to the next. There's no communication. It's complete havoc. Next. And then this is another type of burn. You could have a foot that doesn't even touch electricity, but there was this fellow was in a streetcar, and he was in New Orleans, and was just minding his own business in the streetcar, and these electric streetcars in New Orleans, and somehow he became part of the problem. There was a spark that on one side of the streetcar that found its way to the other side of the streetcar, and his foot happened to be interposed. When this patient hits the emergency room, this is no trivial injury. This could be an injury where the patient ends up losing the foot. Next. So electrical burns can be due to a flash. Somebody could be just, in a room, and all of a sudden there's a flash, if you will. But just an instant flash. And, there's no real zap, but there's a flash. But a flash burn can singe the hairs, and you can have a burn that will lead to some scarring. The pattern that you see there from a flash burn is kind of characteristic. It's over a wide area, obviously, a very wide area. But fortunately, flash burns tend to heal. There's always going to be some scarring, and we're able to do a great deal for this patient after his flash burn. We were able to take his own blood and take his own plasma and prepare it and inject it into the areas. You may have heard about PRP and stem cells. And we're able to recover the function of the skin to a great extent. I've used this technology in turning vets from Afghanistan who were in tanks that had flash burns, which are similar to electrical burns, and they came over here. There wasn't much we could do. We can't cut the burns out. So we tried taking the body's own healing processes, inject it into the zones, and we've got some pretty good results. The Department of Defense has been very supportive of this technology. Next. To remind my audience that you can get a heart attack with an electrical burn. This is an EKG, not my patient, of somebody who got a life-threatening cardiac arrhythmia from an electrical burn. So keep in mind that even though the cardiogram may be normal, as the muscle progressively deteriorates after an electrical burn, so could the heart, and that's not good. That's why you have up to 15% mortality from electrical burns. Next. Please. Okay, so this shows that another patient who could not let go, very similar to a child who chews on an extension cord and can't let go, and they get an oral burn. Next. Pretty devastating injuries. Next. Just demonstrating how bad these can be. Next. They usually require surgical intervention, these electrical burns, because if there is a reversible compromise of circulation due to the massive edema, then we very often go in and make a cut into the extremity to release the edema. And that will restore, hopefully, the circulation to the hand or the foot. It's called a fasciotomy. And of course, taser burns. There have been, sadly, some mortalities from taser burns, not so much because of the insult to the skin and muscle, but because of the fact that the electricity from the taser burn ended up causing those arrhythmias that I demonstrated earlier. So they're supposed to be non-lethal, but they can deliver a lightning pulse of energy, if you will, that can make the heart inoperable. Next. Next, I'm going to skip some of the gory slides. And again, this is a principle. You have an electrical burn, and what you're seeing, you may see this word in some of the reports, this is skin that's no longer alive. It's of a dark color, sadly, and this is skin that has to be removed, what we call a debridement. Debridement, usually electrical burns, is the skin, the fat, and the muscle. Next. This is another image demonstrating the same principles. Next. Down here in Florida, my gosh, we see a lot of folks that have lightning injuries. Lightning is a very common source of electrical burns. We have seen some litigation over failure to warn with lightning strikes. So we're seeing more and more early warning systems with lightning. Okay, let's get my screen back, hopefully. Great. So severe lightning injuries can cause pulmonary arrest, and again, about a third of the patients hit by lightning do die, and we do see a number every year in Florida. Next. Okay, Michael, we'll move on. Go ahead and move. Next slide. I'll be trying. So that's basically electrical burns. While we're trying to move the slide, keep in mind that it could be a very brief strike and cause a big problem. So let's talk now about chemical burns. We're going to leave electrical for a while. We're talking now about chemical burns. Again, chemical burns can be devastating. They're not involved as much in litigation as electrical, because very often they have to do with domestic disputes, more often than not, and they have to do with disputes that are not part of the court arena, maybe the criminal arena, but not so much the civil. And chemical burns tend to be due also to the patient's own carelessness. It's very interesting that chemical burns, unlike electrical, are more often due to the patient being less than attentive. Chemical burns, like electrical, can cause problems outside of the skin, for example, with the kidney, with other areas of the body, but they are more commonly seen in the exposed areas where electrical burns could be anywhere in the body. Next. And the treatment, obviously, with any sort of burn is immediate. Now, chemical burns, and I hope you won't need this information, not all chemical burns are treated with copious amounts of water. That's true with thermal burns, copious amounts of water, because you want to lower the temperature to prevent the progression of the thermal energy. Certain chemicals, if you're burned, for example, certain dry chemicals, a white powder, for example, causing a burn, putting water on a dry chemical burn can make it worse. So in an attempt to be a good Samaritan, I hope you never need this information, think if it's a dry, powdery chemical burn, I would not add water. You'll make the problem worse. Next. And burns in general, whether it be electrical or chemical, you're almost always looking at $500,000 in medicals, and you're looking at lost productivity, you're looking at permanent scarring, and you're almost certainly looking at disability. And that's where we as an expert help you, the attorneys, plaintiffs, and defense, is to understand these this disability. Keep in mind, as always, that these costs look quite high. They are frequently reasonable and customary. And in our country, with Obamacare, Medicare, and other programs, the reasonable and customary cost of medical services is declining. Next. So again, I mentioned this earlier, acid and alkalis, the acid burns tend to cook the skin real quickly so they don't go deep, whereas the alkali burns don't cook as quickly so they go deeper. Next. So a patient, this is a very, very good example. This is a state trooper. This poor lady was 40 years old, and she was ticketing a driver that was on the side of the interstate. And at that time, the state troopers would come around to the driver's side, and God darn it, she was hit by a drunk driver. And she burst into flames for some reason. I'm not quite sure, but she burst into flames. And she sustained a long, long hospital course. She had to retire from being a Florida State Trooper. And she developed this area of scarring. Look at the skin, very leather-like, very leather-like. And when you pushed on it, it felt like unhuman. And obviously there's no real plastic surgery in the traditional sense for this poor lady. And I thought about what I used earlier when another patient, when I took the patient's own blood, patient's own plasma, prepared it in a centrifuge, and then I injected into the area that was leathery. And what this did without surgery is it restored the contour, the suppleness, the hair follicles. It didn't take away the scarring, but it helped the function tremendously. So now we have options for the victims of chemical and electrical burns. Next. And chemical burns are caused by a wide variety of agents. My gosh, we're surrounded by offending agents. So they are very common. But the takeaway again here is not all chemical burns are diluted with water. Next, please. And again, it's very similar to electrical. The sequelae is due to how long the chemical was allowed to injure the skin, if the skin was intact, where it was located, the amount of chemical. These are intuitive, this is obvious. It's due to basically a number of factors. That's why not all chemical burns are created equally. Next. And you can end up having a thumb that doesn't move or a finger that doesn't bend because the skin is normally supple, soft, and an injured skin is never the same as what God gave you. Next. Now, getting to some basics. I apologize if this is very basic, but you may see these on your reports. Burns are classically described as superficial, for example, a sunburn. A sunburn typically does not leave a scar. A partial thickness burn is a second-degree burn. They do leave scars. Second-degree burns can cause changes in skin color, changes in skin texture, can cause loss of function, loss of pigmentation, loss of protective hair follicles, loss of protective skin appendages. So a second or partial thickness burn certainly does have some attendant disability. Obviously, the worst is a full thickness burn, a third-degree burn. A third-degree burn goes through the skin, the fat, the muscle, and it wreaks complete havoc on the body. And a full-thickness burn almost always needs a skin graft, taking skin from one part of the body and moving it to another part of the body. The numbers you may see in reports are first, second, third, and sometimes fourth. Fourth is not demonstrated here. First is a sunburn. Second is a partial thickness burn, for example, a radiator exploding. I had a guy today, he was uncorking his radiator and exploded in his arm. That's a partial thickness burn. Partial thickness burns are almost always healed in 3 weeks, and a full thickness burn will not heal in 3 weeks and require some sort of graft or flap. Next. And again, the treatment of a sunburn, superficial, is basically cool compresses, at home aloe vera. Hair follicles are preserved. A small chance, very small chance of skin cancer 20, 30 years down the road. Next. Partial thickness. Here is intense pain. There's a blister, and the blister should be left intact. Never open up blisters, and basically irrigate the blisters, but don't open them up and then apply an antiseptic cream. Second degree, partial thickness. Next, and this refers to chemical as well as electrical. Third degree, all the way through the skin. The skin's dry and leathery, as I demonstrated in previous slides. There's not much pain because the pain nerves are gone. All the layers of the skin are involved, and the treatment is obviously hospitalization, in or out, followed rehabilitation. Next. I'll be taking questions at the end. We're getting close to the end. As soon as Michael gets us back online. But typically, if a burn is not healed in 3 weeks, it does require some skin grafting. The rule of 9, you may see that. Basically, it's used to estimate the amount of burn. And as I mentioned at the beginning of my presentation, you can go to jury verdicts all around the country, find the amount of body burned, and then you can get an estimate of where juries have come back. Juries seem to understand that these are painful. I keep in mind that the chance of a patient dying, you can take the patient's age, say the patient's age is 30, and they have a 10% body burn. They have about, believe it or not, a 40% chance of serious mortality, morbidity or mortality. It's called the rule of 9s for the body surface area. Next. And these are charts you'll see in the medical records, the very convenient charts. 18 is, means if that area is burned, 18% of the body is burned. You see the 9, you see the head burned, that means 9% is burned. And again, these percentage body burns are correlated with future medical care costs. There's actually a very reasonable indication on the internet of where juries come back. Now, I will also share with you, and this is very, very helpful, the American Burn Society has given us information that can correlate the temperature of water with the extent of burn. We actually have recognized tables. And these recognized tables can tell us the temperature of the water. Say this hand, say 18% of the body goes underneath hot water, and that 18% of the body is burnt. We can get an idea of the temperature of the water. And as my audience knows, the lawyers, Chili's and McDonald's have a, Chili's and McDonald's have a formulary, and other major franchises have a formulary that the water temperature for the coffee and tea is not to go above a certain level. So basically with this formulary, we can tell whether or not there is a deviation from their standards. Okay, next. So I can give you the temperature of the water that burnt the patient. And as an aside, I hope that was clear. If it wasn't, please ask me the questions. If you look at the rule of palms, you take your palm, that's about 1% of the body surface area. Next. And again, burns, whether it be electrical or chemical, can have problems with shifting of fluids and dry, leathery skin. Next. Sadly, great risk of infection with burns. Sadly, because of the muscle being injured, the myoglobin is released, and the myoglobin is the end product of the injured muscle, and that wreaks havoc in the body. The older the victim, sadly, the worse the prognosis, the more the disability. Age is associated with worse complications, and obviously health, a diabetic, for example, would have more chance of complications. And as a reminder, smokers, nicotine interferes with good healing. The nicotine squeezes the blood vessels, squeezes them in a way that the body can't send the healing nutrients to the zone of injury. Next. So as I mentioned earlier, if you come across an electrical injury, please turn off the power first. And lightning strikes, obviously they come and go fast, so we don't have that issue. Next. And with chemicals, you obviously, when someone has a chemical burn, you have to call in the hazardous team to come in and clean up and do it in an appropriate way. Specific chemicals have specific antidotes. So that's why after the police release the tear gas, for example, or they release whatever they release, you can't willy-nilly go into that zone. It has to be sized up and cleaned up. Next. And this, again, is a reminder, dry lime does not mix with water. Next. These are very specific examples of adding water to a burn would make things worse. Next. So with all these burns, electrical and chemical, what you see is not what you get. There's a progression. There's a lot that's not seen in the beginning. There's a lot that's going to happen down the road. You constantly have to reevaluate, reevaluate, reevaluate. Next. Well, thank you for attending. I do a lot of this work for both plaintiffs and defense. A lot of this science now is measurable, and that helps a great deal. And when you're dealing with opinions that are, ridiculous, junk science. And I'm so glad that the American Burn Society is trying to give some objective information to the court as to contact time, as to extent of injury, as to the temperature, even the voltage. A lot of this information now is very readily available, where in the past it was very speculative. Okay, Michael, that's all I have. I'm open to any questions.
Thanks so much, Dr. Zayden. We do have some questions coming in. The first one is, does the amount of time that the skin was in contact with a certain temperature of water have anything to do with the degree of burn?
Absolutely, absolutely. And we have tables that are published, that are discoverable, that can correlate time of the burn with the temperature. Very often, and I've seen this last week, I had a girl that was burnt. She was at Chili's in the drive-thru, and the coffee spilled on her slacks. And I'm able to correlate the temperature of the water with the burn extent. And I also will share with you that I hope you don't have a burn through your slacks. You need to take those slacks off because they act as an incubator, and it prolongs the injury. So in some ways, a burn through your pants and skirt can cause more of a problem than directly on the skin. It's kind of surprising, but the clothes might act as an incubator.
Great. Next question. How soon can a patient have a skin graft after a burn?
If it's obviously third degree, immediately is fine. Sometimes we can't tell. It might be a second, it might be a third. So I typically wait up to 3 weeks if I'm not sure.
Okay. Next question. Can you please explain what is PRP?
PRP is it's a derivative of the patient's own blood. We take the patient's own blood, we spin it in a centrifuge, we get the good, healthy cells out of the test tube, and we inject to the patient's zone of injury his own good cells so the body can heal itself. It's almost like, homeopathic medicine. Life heals life. The body heals itself. It is now on label. It is now approved by not only the Department of Defense, as I mentioned, it's approved by workers' comp, state of Florida, Dade County schools. Orthopedics are being reimbursed. So we're no longer in the investigational stage of PRP stem cells. It is now becoming more mainstream.
Great.
It's no longer experimental.
Okay. Thank you, Dr. Zayden. This is the last and final question. What is stem cell PRP?
Stem cells are the body's embryonic cells. These are cells that can reinvent themselves to any sort of cell. You have to stimulate the stem cells. You can take a stem cell and you can stimulate it to become skin. You can stimulate it to actually build a three-dimensional organ like a bladder. Stem cells are cells that have many, many potentials, and they are prodded to do good things.
Okay. I think that's it for today. Thanks so much, Dr. Zayden. It was an excellent presentation.
I enjoyed speaking with everybody, and please do not hesitate to call the Expert Institute or myself. Thank you.
All right. Thanks again. If anyone is interested in retaining Dr. Zayden as an expert witness, please contact the Expert Institute, and we will facilitate the engagement process. Thanks again, and stay tuned for more webinars in the near future.
Bye-bye now.